when treating the symptoms of burning with urination, frequent urination, burning when you pee, accidents like incontinence, we usually will treat as a urinary tract infection. Those symptoms, if they're common, especially to a woman, usually the treatment is based on the tests. Physical exam, if it's pretty normal, will bring us to the test. The tests are either a monitor to check out the urine or a dipstick. Dipstick this is the classic way, and it's usually a stick that's placed into the urine and then read in about 30 seconds. Depending on the findings, if we find leukocytes, which are white blood cells, nitrites, blood, then we'll go ahead and treat while sending the urine off for a culture. A culture is necessary if these symptoms are unusual, or if you have the extremes of age. If you have a little kid that comes in or an elderly person that comes in, then we want to know what kind of bacteria grows out. Now you'd figure if the symptoms get better with antibiotics, does the culture make any difference? No. If you get better with the choice of antibiotics, which usually is a Bactrim, macrobid, or amoxicillin, then it doesn't matter what the culture grows out. We're probably going to just ignore it because you're feeling better. But most important, if you don't get better, or if that little kid or that elderly person gets worse, then you have the culture to go back to and study. And if you didn't get a culture the first time, then you can't do one while you're on antibiotics or getting worse. So that's why we usually, as a precaution, send off a culture with a urinalysis. There are other things you can do. Cranberry herb, cranberry concentrate, has been shown to inhibit E. coli. E. coli is the bacteria that typically causes urinary tract infections in women. And some people can beat the urinary tract infection just with that alone. A lot of fluid, a lot of cranberry juice, sometimes something called erva usari for about 5 days will help with beating the infection before it sets in. Now, if you have immune symptoms or immunocompromised states, then you probably shouldn't mess around. You should just come in for a culture and an antibiotic. If you're a man, that's unusual to get a urinary tract infection, so it really needs a workup. Women, has a rule of thumb, are allowed to have 3 a year, just because the length of the urethra, that means the length of the tube from the outside of the perineum to the bladder, is much shorter than the length of the tube from the tip of the penis to the bladder in a man. That's typically why men don't get urinary tract infections. So, in a nutshell, there are 2 things to do, as I mentioned, erva usari or cranberry. There are some who like the use of D-mannose. I haven't found reproducible studies to say that it's great for a urinary tract infection, but it's very benign. It's essentially a sugar. Increasing fluid intake, and then sometimes if it's the honeymoon cystitis or the urinary tract infection that comes from postcoital activity, urinating after intercourse would be important. And you don't have to run to the bathroom, but sometime within the hour after intercourse, if you urinate, it pushes all the bacteria that are in the entrance to the urethra out so that they don't continue heading to the bladder. Hopefully this helps. Always see your doctor in case there's any persistent problems.